How are the intercostal muscles positioned relative to the ribs? Lateral, medial, superficial, or deep? Deep. The intercostal muscles occupy the intercostal spaces, lying deep to the ribs but superficial to the parietal pleura. What is the relationship between the mandible and maxilla? Superior, anterior, inferior, or posterior? Inferior. The mandible is the only movable skull bone and articulates with the temporal bones, positioned inferior to the fixed maxilla. How is the ulnar nerve positioned relative to the medial epicondyle? Superior, anterior, posterior, or inferior? Posterior. The ulnar nerve runs posterior to the medial epicondyle in a superficial groove, making it vulnerable to compression or trauma. What is the position of the prostate gland relative to the urinary bladder? Posterior, anterior, superior, or inferior? Inferior. The prostate gland surrounds the prostatic urethra immediately inferior to the bladder neck, which is why prostate enlargement obstructs urine flow. How are the palmar interossei muscles positioned relative to the dorsal interossei? Dorsal, distal, palmar, or proximal? Palmar. The palmar interossei are located on the palmar surfaces of the metacarpals, where they adduct the fingers. In contrast, the dorsal interossei are positioned more dorsally and function to abduct the fingers. Therefore, the palmar interossei are palmar to the dorsal interossei. What is the relationship between the cerebellum and cerebrum? Anterior, superior, posterior, or inferior? Posterior. The cerebellum occupies the posterior cranial fossa below the tentorium cerebelli, positioned posterior and inferior to the cerebral hemispheres. How is the tibialis anterior positioned relative to the extensor digitorum longus? Deep, lateral, medial, or superficial? Medial. Tibialis anterior is the most medial muscle of the anterior leg compartment, while extensor digitorum longus lies lateral to it. What is the position of the aortic arch relative to the trachea? Posterior, anterior, inferior, or superior? Anterior. The aortic arch curves anterior to the trachea and left main bronchus in the superior mediastinum before descending posteriorly. How are the vocal cords positioned relative to the vestibular folds? Superior, medial, lateral, or inferior? Inferior. True vocal cords for sound production are inferior to the false vocal cords, which help protect the airway. What is the relationship between the radius and scaphoid bone? Proximal, posterior, anterior, or distal? Proximal. The radius articulates with the scaphoid at the wrist joint, making it proximal along the upper limb axis. How is the gastrocnemius positioned relative to the soleus? Medial, deep, lateral, or superficial? Superficial. Gastrocnemius forms the visible calf bulge and lies superficial to the soleus. Both merge to form the Achilles tendon. What is the position of the hyoid bone relative to the thyroid cartilage? Inferior, anterior, posterior, or superior? Superior. The hyoid bone floats superior to the thyroid cartilage, serving as attachment for tongue and suprahyoid muscles. How are the atria positioned relative to the ventricles? Superior, inferior, anterior, or posterior? Superior. In the anatomical heart position, the atria are superior to the ventricles. What is the relationship between the pulmonary artery and pulmonary vein? Inferior, posterior, anterior, or superior? Anterior. At the long hilum, the pulmonary artery is typically anterior and superior to the pulmonary veins. How is the fibularis longus positioned relative to the fibularis brevis? Posterior, anterior, superficial, or deep? Superficial. Fibularis longus lies superficial to fibularis brevis and the lateral leg compartment. Both avert the foot. What is the position of the mastoid process relative to the external auditory meatus? Superior, anterior, inferior, or posterior? Posterior. The mastoid process projects inferiorly and posteriorly from the temporal bone, located posterior to the ear canal. How are the metacarpal bones positioned relative to the carpal bones? Palmar, proximal, distal, or dorsal? Distal. Metacarpals form the palm and are distal to the carpal bones and proximal to the phalanx. What is the relationship between the nasopharynx and oropharynx? Posterior, inferior, anterior, or superior? Superior. The nasopharynx lies posterior to the nasal cavity and superior to the oropharynx, which extends from the soft palate to the epiglottis. How is the deltoid muscle positioned relative to the shoulder joint? Medial, deep, lateral, or superficial? Superficial. The deltoid forms the shoulder contour and is the most superficial muscle, overlying the glenohumeral joint and rotator cuff. What is the position of the jejunum relative to the ilium? Proximal, anterior, posterior, or distal? Proximal. The jejunum is the proximal 2/5 of the small intestine, while the ilium is the distal 3/5, with gradual histological differences. How are the plantar muscles positioned relative to the plantar aponeurosis? Deep, superficial, medial, or lateral? Deep. All intrinsic plantar muscles lie deep to the thick plantar aponeurosis, which supports the foot's longitudinal arch. What is the relationship between the clavicle and first rib? Inferior, superior, posterior, or anterior? Superior. The clavicle crosses superior to the first rib. Neurovascular structures to the arm pass between them. How is the trapezius muscle positioned relative to the rhomboids? Superficial, medial, lateral, or deep? Superficial. Trapezius is a large superficial back muscle that overlies the rhomboid major and minor muscles. What is the position of the optic chiasm relative to the pituitary gland? Superior, anterior, inferior, or posterior? Superior. The optic chiasm sits superior to the pituitary gland. Pituitary tumors can compress it, causing bitemporal hemianopia. How are the lumbar vertebrae positioned relative to the sacrum? Inferior, anterior, superior, or posterior? Superior. The 5 lumbar vertebrae are superior to the sacrum, with L5 articulating with the sacrum at the lumbosacral joint. What is the relationship between the epidural space and dura mater? Medial, deep, superficial, or lateral? Superficial. The epidural space is outside the dura mater and contains fat and venous plexuses for epidural anesthesia. How is the pectoralis minor positioned relative to the pectoralis major? Medial, deep, lateral, or superficial? Deep. Pectoralis minor lies deep to pectoralis major, originating from ribs 3 to 5 and inserting on the coracoid process. What is the position of the talus relative to the calcaneus? Posterior, anterior, superior, or inferior? Superior. The talus articulates with the tibia fibula above and rests directly on the calcaneus below, transmitting body weight. How are the interventricular septum positioned relative to the right ventricle? Lateral, anterior, posterior, or medial? Medial. The interventricular septum forms the medial wall of the right ventricle, separating it from the left ventricle. What is the relationship between the saphenous vein and femoral artery? Superficial, lateral, deep, or medial? Medial. The great saphenous vein runs superficially on the medial thigh. The femoral artery lies deeper and more lateral. How is the gluteus medius positioned relative to the gluteus minimus? Superficial, posterior, anterior, or deep? Superficial. Gluteus medius is superficial to gluteus minimus. Both are crucial hip abductors for gait stability. What is the position of the phalanx relative to the metacarpals? Dorsal, palmar, distal, or proximal? Distal. Since the fingers extend away from the palm, the phalanges are located farther from the body's center than the metacarpals are. How are the coronary arteries positioned relative to the epicardium? Medial, superficial, deep, or lateral? Deep. Coronary arteries run within the epicardial fat on the heart surface, deep to the visceral epicardium. What is the relationship between the basilic vein and brachial artery? Lateral, medial, superficial, or deep? Medial. The basilic vein ascends superficially on the medial arm. The brachial artery runs deeper in the medial bicipital groove. How is the vastus intermedius positioned relative to the rectus femoris? Deep, medial, lateral, or superficial? Deep. Vastus intermedius lies deep to rectus femoris, directly on the anterior femur, as part of the quadriceps group. What is the position of the ischium relative to the ilium? Anterior, inferior, posterior, or superior? Inferior. The ischium forms the inferior and posterior part of the hip bone, including the weight-bearing ischial tuberosity. How are the olfactory bulbs positioned relative to the cribriform plate? Anterior, inferior, superior, or posterior? Superior. Olfactory bulbs sit above the cribriform plate, receiving smell signals through its foramina. What is the relationship between the transverse colon and small intestine? Posterior, inferior, anterior, or superior? Superior. The transverse colon crosses the upper abdomen superior to the coils of jejunum and ilium. How is the pronator quadratus positioned relative to the flexor tendons? Deep, proximal, superficial, or distal? Deep. Pronator quadratus is the deepest forearm muscle, lying deep to the flexor tendons at the wrist level. What is the position of the manubrium relative to the body of the sternum? Posterior, inferior, anterior, or superior? Superior. The manubrium is the superior sternal portion that articulates with the clavicles, superior to the sternal body. How are the semicircular canals positioned relative to the cochlea? Posterior, anterior, superior, or inferior? Posterior. Semicircular canals are posterior to the cochlea in the inner ear. What is the relationship between the inguinal ligament and femoral vessels? Inferior, posterior, superior, or anterior? Superior. The inguinal ligament forms the superior border of the femoral triangle. Femoral vessels pass inferior to it into the thigh. How is the serratus anterior positioned relative to the scapula? Inferior, posterior, superior, or anterior? Anterior. Serratus anterior lies on the anterolateral chest wall, deep to the scapula, holding it against the ribs. What is the position of the duodenum relative to the pancreas? Superior, posterior, anterior, or inferior? Inferior. The duodenum curves around the head of the pancreas, primarily lying anterior and inferior to it. How are the palmaris longus and flexor carpi radialis positioned? Lateral, deep, medial, or superficial? Medial. Palmaris longus lies medial to flexor carpi radialis in the superficial anterior forearm. What is the relationship between the foramen magnum and spinal cord? Superior, inferior, posterior, or anterior? Superior. The spinal cord is continuous with the medulla and exits the skull through the foramen magnum, making the foramen superior to the cord's exit point. How is the obturator internus positioned relative to the obturator foramen? Superior, lateral, medial, or inferior? Medial. Obturator internus originates from the inner surface of the obturator membrane and foramen. What is the position of the xiphoid process relative to the sternal body? Inferior, posterior, anterior, or superior? Inferior. The xiphoid process is the small cartilaginous inferior tip of the sternum, extending downward from the sternal body. How are the plantar ligaments positioned relative to the plantar muscles? Superficial, deep, medial, or lateral? Deep. Plantar ligaments provide arch support and are located deep to the plantar muscles in the foot. What is the relationship between the mitral valve and aortic valve? Medial, posterior, anterior, or lateral? Posterior. The mitral valve is posterior and slightly left of the aortic valve, with fibrous continuity between them. How is the tibial nerve positioned relative to the popliteal artery? Anterior, lateral, posterior, or medial? Posterior. The tibial nerve is the most superficial structure in the popliteal fossa, lying posterior to both the popliteal vein and artery. From posterior to anterior. Nerve. then vein, then artery. What is the position of the brachialis muscle relative to the biceps brachii? Medial, superficial, deep, or lateral? Deep. The brachialis is the primary flexor of the elbow and lies deep to the biceps brachii, originating from the anterior surface of the humerus. How is the spleen positioned relative to the left kidney? Lateral, superior, anterior, or medial? Anterior. The spleen is a lymphoid organ in the left upper quadrant. It lies anterolateral to the left kidney, separated by the splenorenal ligament, and is protected by ribs 9 to 11. What is the position of the common bile duct relative to the portal vein? Posterior, medial, lateral, or anterior? Anterior. The portal triad runs within the hepatoduodenal ligament with the common bile duct, the hepatic artery proper, and the portal vein. How are the flexor tendons positioned relative to the carpal tunnel? Lateral, medial, deep, or superficial? Deep. The carpal tunnel is a narrow passage. The flexor tendons and the median nerve pass deep within it, beneath the flexor retinaculum. Compression causes carpal tunnel syndrome.